Up next is Dr. Catherine Backman. Please, I know this is an important topic for me, changing shoes. Don't want to.
I should be doing one on hand function related to the pinch required to get this microphone on. I'm pleased to be here and join everyone at this ROAR event. Now for a little change of pace, we're going to talk about qualitative research. So the types of studies that have been quoted so far have been looking at different ways of measuring performance, and we're looking in this study at how people describe some of their experiences with arthritis. People lead storied lives. The way we think about our lives and our experiences, we really recall in forms of different stories. We tell people stories about what's important to us, not important to us, what frustrates us and annoys us, and we tell that in stories or in forms of narrative. And that's how we make sense of some of the things that are happening to us, is by telling those stories. And when we tell the stories, we use a range of different devices. I'm taking you back to your English lessons or language arts when we talked about we use metaphors and similes in order to describe or try and share the impact, help us understand the complexity of things that are going on around us. And that's how we understand the significance to other people of what's happened to them when we pay attention to some of the stories that they tell and the narrative devices that they use when telling those stories. And how people interpret their experiences really tells us a little bit about what's not only important to them, but how they view themselves, their sense of identity, their sense of self, and tells us, in this case, about their experiences with the healthcare system or healthcare providers. So the purpose of this study was to explore how these metaphorical descriptions of emotional and physical adjustments to living with rheumatoid arthritis, or RA, serve to effectively communicate the impact of living with rheumatoid arthritis on somebody's identity, to the people around them, to the healthcare providers that they work with. And this was a secondary analysis of data from two different qualitative studies. That means that these two studies had been conducted for a different purpose, where we interviewed a number of different people to understand a different research question. The first study, the research question was to look at the impact of inflammatory arthritis on the role of mother, and that was done with 12 women. So we did in-depth interviews. Instead of getting a little bit of measurable data from hundreds of people, we got a lot of data from narrative forms of data from just a few people, so we tried to get an in-depth understanding. The second study, we explored help-seeking process in 37 women who had just been diagnosed with rheumatoid arthritis in the past year. When we had done these studies, the research teams that were involved in them, we noticed that people told a lot of stories about shifts in their identity and how they viewed themselves, and they also spoke a lot about different events in their lives, one of which was shoes, how they had to get rid of different shoes, or how they changed shoes, and they used that as a metaphor. They had to change shoes and move into a new role. They also told metaphors about family dinners and the chore of weeks on end, especially coming up to the holidays now. Those of you who prepare a family dinner spend every weekend for 3 weeks ahead of time doing all the baking and preparation, and people consume it in 20 minutes. And did we actually have a good time while we were doing it or not? So there were a number of different metaphors like that in these stories. So that's why we went back to these data and looked for the metaphors within them. So during those original analyses, we observed these metaphorical descriptions or different narrative devices. So we reviewed all 49 of these in-depth transcripts. Each transcript would be about 40 or 50 pages in length, so we had lots of descriptive data to look at. And we noted that these narrative descriptions of how RA experiences shaped people's sense of self or their sense of identity, and then we constructed representative metaphors from these descriptions. So of several metaphors that we identified, changing shoes was the most powerful and most repeated example of how we could capture some of the experiences of living with rheumatoid arthritis and its impact on who I am. So the descriptions of actual events, so that women described how they could no longer wear shoes that reflected their style, their preferences, or their life roles. And while we might think of this as kind of a superficial thing in the context of serious illness, so what, you have to wear a different pair of shoes? Actually, it was representative of really profound experiences and life experiences. So people were losing a sense of themselves when they lost that pair of shoes or set that pair of shoes aside. They were losing their profession. They were losing their working self. They were losing their sense of self that might be associated with different clubs or groups that they were part of. They were losing their sense of style. There were a lot of losses that were occurring as a result of rheumatoid arthritis that was represented by the changing shoes. So I'm going to share some of the quotes or experiences. And the purpose of sharing these quotes is to share some illustrations that help impart the impact of living with rheumatoid arthritis to people who don't have that wonderful opportunity of living with chronic illness, but might want to be a little bit more empathic about what's actually involved and understand some of those experiences so that we can work together to overcome some of those changes or recognize some of those changes and help people find a new self. It's not a bad news story, it's a transition story. How do we find our new self? So here's one quote: "No more shoes, no more the way I used to dress. It took my whole life and turned it right upside down." Now, if you're not an exerciser, you're more sedate, and you always wore the old granny shoes, which are probably better for your feet. But if you have all that in place, then you're not necessarily going to be hit as hard. But bang, I was in it. A shock to the system, to everything. All of a sudden, my life just came to a standstill. Or this one: "I cannot wear my high heels, shoes. I love them. I like to dress up a bit fancier with the high heels. Now I have to keep it simpler and comfortable and mostly just runners or flat shoes." This one, talking about work transitions and actually changing the shoes. "You know, steel-toed boots in the pouring rain, and it's not comfortable having the wind blowing on arthritis in the rain. It wasn't going to work," which was sad. And this was part of the story that this woman told. She worked on the ferry docks, and so she directed traffic on the ferry docks, and she was wearing steel-toed boots as part of her job. So the giving up of the steel-toed boots was also giving up the job on the ferry docks there, so she had to look for new work. Another woman: "I took my children to the fair, and that's when I first realized that something was really wrong because my feet were killing me and I love walking. I went from one pair of runners to another, and my feet were so sore I bought sandals. I shed a few tears thinking, oh no, this arthritis is chronic." And this was a newly diagnosed woman at the beginning of giving up playing basketball with her kids, giving up running and gardening, which she really loved. She was talking about the giving up of shoes and the giving up of some things until she got her arthritis under control. Another one: "I started wearing flat shoes." So flat shoes meant pants. Men may not understand this. You cannot wear flat shoes with most dresses. You need a heel. The flat shoes meant pants and never wearing dresses, and I was dressing differently, and my life became different. And after a couple of years, it just, you know, the RA wasn't getting any better. I came to a realization that this was it. I was giving up skiing, tennis, and that part of my life is gone. So metaphors that were used by women in their narratives of living with RA do effectively communicate really core aspects of their individual experiences and their identity. In the example that we present here, changing shoes represents not only the physical adjustment to accommodate pain, but also part of an internal process of reshaping identity. I've got to get comfortable with the new shoes, the new identity, the new roles that I'm going to assume. Women eventually gave up their shoes and found a new sense of self, or an identity that was no longer represented by the old shoes. So it's not always a bad news story, despite the impact of some of these selected quotes. talking about the bad news time in somebody's life, eventually people find a new identity and a new role to assume. And certainly when I've shared the findings of some of this research with patient advisors to research, they said they actually knew that was when they were becoming an advocate for people with arthritis, because they put those shoes that they couldn't wear because they weren't comfortable into a closet, thinking eventually the medication would kick in or they'd figure out a way to manage their arthritis and they'd wear those shoes again. And then when they knew they could give those shoes away to charity was when they knew they could start living a different life with rheumatoid arthritis and start advocating for other people with arthritis and adopt a new identity that was represented by entirely new shoes. So the implications of this research help healthcare providers and other people who support those living with arthritis to appreciate how seemingly small changes really can carry great meaning with regard to one's identity. And this can foster more effective patient-provider communication and client-centered practice. So the message to healthcare providers is that when someone says, "I can't wear my high heels," there might be a big story behind there. So you don't want to just shrug that off necessarily. So yes, shoes are a big deal to many people. Not everyone, but to many. And more importantly, they really represent some poignant losses that accompany chronic illness. As Lynn has identified, no research happens in isolation or by one person by themselves. So I do want to acknowledge those who were involved in and funded both of the two studies from which these data were derived. And Kelly English, who's the patient advisor who had a look at the slides to make sure they make sense to a more general audience. And I also want to give a plug to Otto Kamansik, who's brought some of his sculptures here. They're in the lobby for you to have a look at during the break. And this is one of his sculptures called Healed. And Otto's work represents some of his identity as an artist and someone living with inflammatory arthritis, and many of his experiences with pain and loss living with arthritis are reflected in his sculptures. So I'm good for time, and there's time for a couple of questions then. Great, thank you.
Dr. Backman. If there's any questions, I'll walk in my new arthritis-friendly shoes. So.
Catherine, you just explained to me why I have to give up those suits with skirts.
Yeah.
And I will give up my high-heeled shoes that I've been looking at, thinking I can wear again. But you also, it explains why I've spent so much money on Eileen Fisher clothes, because they look good with pants.
Yes.
Thank you.
I'm sure Eileen Fisher appreciates the plug.
Any other questions, comments?
I'm just wondering how did these women change? Like, was there a common thing they did, or did it just take time and they tried? And
yeah.
Was there
So how did these women change? So how did they shift or adjust that identity? Yeah. So some of the women from the mothering study, they had lived with rheumatoid arthritis for a very long time. In the early help-seeking study, those people had been diagnosed only in the past year, but many of them we know from the in-depth study had been experiencing symptoms for up to a decade before they had been diagnosed and figured out what it was. And so some people had not yet found their new identity or made the adjustment. They were still struggling a little bit, but others had basically what they described was, I came to realize. So something happened as they were living day to day where they find the penny dropped and they said, you know what, this arthritis is here, it's part of me, I get to choose how I live with the arthritis doesn't decide how I live. And so they had come to this realization that they could still make choices and they were going to take charge of their arthritis and live with it. So everybody comes to that realization differently. And I think that it's really important for us to share the stories from the women or any people living with chronic illness of how they came to that realization, so that the people who are stuck right now in trying to figure out how to take control of their arthritis can maybe identify with or find an experience that might help them make that same adjustment. But it is kind of a mind shift where you have to realize that I can do something about this, and nobody can get you there. You have to, we can support you along the way, but you kind of have to get there on your own and make your own shift.
I have a question from one of our webcast viewers. Are there any programs which help people deal with the emotional side of coping with these changes to their lives?
So are there any programs that help us adjust with these emotional changes? So yes, there are. So people will address some of the psychosocial impact in programs that, like the Arthritis Self-Management Program, so that psychosocial adjustment is part of that. But I think here, and I would hope that on the webcast people are probably sharing some ideas, that people can often join a chat group that's available online. And Kelly English, who reviewed my slides, she spoke eloquently last year at ROAR about the chat group that she joined. So finding a group of like-minded people where you can share those kinds of experiences. So following someone's blog. Spoonie Room is one where she shares some of her experiences. So that patient-to-patient kind of contact is one way. And then I would also suggest that you ask your healthcare providers about connecting with an occupational therapist, a social worker, or a psychologist who can direct you to programs that might be suitable. Good for time?
Thank you very much, Catherine Backman.
Yeah, so there was a plug there for a 3-week program at the Mary Pack Arthritis program.
Very good. Thank you so much, Dr. Backman.